confirmed aggregate cases of coronavirus in Victoria. That is 113 new cases since yesterday's update. I'm saddened to have to report that there are now 485 Victorians who have lost their life due to this global pandemic. That's an increase of 23 since yesterday's report. Our thoughts, our condolences, our deepest sympathies are with each of those families at what will be a very, very difficult time. They include one male in their 60s, one female and 4 males in their 70s, 6 females and 3 males in their 80s, and 5 females and 3 males in their 90s. 22 of those 23 deaths are linked to aged care outbreaks. There are 532 Victorians in hospital. 29 of those are receiving intensive care and 11 of those 29 are on a ventilator. The Chief Health Officer released later today will have a fully reconciled testing number. We're just working through latest information from labs, but we've clearly done more testing overnight, but the final number will be included in the Chief Health Officer's release later on today. There are 4,151 cases with an unknown source, mystery cases. 35 have been closed out and added to that total since yesterday's update. There are 391 healthcare workers who are active cases, so those numbers have stabilised and continue to fall, and that is obviously good news. We don't want any of our healthcare heroes to be getting sick doing the work that they do. That's been a feature of many of the announcements and much of our discussion this week, and I want to thank all the team who are working very hard, whether it be in terms of the provision of PPE, analysing the data, working as hard as they possibly can to make sure that our healthcare environments, aged care all the way through to hospital care, is as safe as it possibly can be, obviously for patients, for residents, and most obviously for staff. We send our best wishes to all of those staff who are unwell, and again, it's a powerful reminder to every single Victorian that by playing our part, by doing what we need to do, following the rules, coming forward, getting tested as soon as we get even the mildest of symptoms, we're not just protecting our family and every family, we're protecting those heroes, the last line of defence, those nurses and doctors, AMBOs, all of our hospital team, all of our healthcare team. That's a really powerful way in which we can thank them for their courage and their commitment, their absolute compassion and the skill that they bring to their very considerable task. We thank them and let's all of us do what we can to keep them safe. There are 3,308 active cases across the state, so those numbers continue to fall, which is good news. In terms of the regional metro split, as I always point out, these numbers don't always perfectly reconcile just because there's a number that is still being investigated, but there's now 198 active cases in regional local government areas that are under stage 3. To give you an example, across a number of key regional communities that we've been speaking about, they're key for that purpose. Geelong, the Greater Geelong area, 71 active cases. Greater Bendigo, 16, and Ballarat has 6 active cases. That is a much better position than we were in a few weeks ago. Those numbers are falling. Those numbers will continue to fall, obviously, as people go through their active period as a positive. And then we'll see those numbers continue to fall. But there should be no sense of complacency in those communities or in any community. Regional Victorian numbers are low. We're doing everything we possibly can in a really strong partnership between the government, public health team, all the workers, if you like, in this, as well as families right across regional Victoria, communities right across regional Victoria. We've got to continue to do everything we can to keep those numbers low. But that is a pleasing decrease. And a steady decrease in terms of the number of active cases in regional local government areas. In disability facility settings, there are a total of 48 active cases. In aged care settings, there are a total of 1,412 active cases. And in terms of aged care shifts that have been worked by hospital staff, to whom we are so grateful, we're now up to 3,062 shifts that have been worked. That is a massive effort in terms of people who would normally be working in a very different environment. They've gone into aged care homes. They have provided the very best of care, helped to stabilise those environments when many of them could not have been described in those terms. They've done a mighty job, and we're very, very proud of them and grateful to them, and I'll continue to update you as those numbers grow. In general terms, though, we have seen some stability come to aged care settings. That is a good thing, but it's by no means over. There needs to be the important continuation of that joint approach where all governments, together with agencies, are all working together as one, focused on only one thing, and that is the very best care for residents and patients, and then providing the best information to families. That is very challenging, but our staff, a big team, are doing an amazing job in very, very difficult circumstances.